Alzheimer's disease, or AD, affects over 25 million people worldwide. Early diagnosis for AD is challenging, given the heterogeneous symptoms, pathogenesis, and overlapping clinical features with other dementias. Screening for the pathogenic proteins, amyloid beta, or A-beta, and tau, in the cerebrospinal fluid, or CSF, can guide the diagnosis of AD. However, testing is limited in clinical practice owing to the lack of infrastructure, uncertainty about clinical value, and the perception that lumbar puncture, used to draw samples, is complex and invasive. In a recent expert perspective, researchers sought to demonstrate the application of CSF biomarkers in AD diagnosis through review of existing literature and presentation of novel case studies. These cases included patients with symptoms like memory loss, loss of coordination, poor work productivity, poor vision, and anxiety. In cases where clinical history, cognitive and psychiatric assessments, and neuroimaging results were not sufficient to develop a working diagnosis of AD, testing for CSF biomarkers, including A-beta 42, phosphorylated tau, and total tau, were used to determine if AD was the putative cause of cognitive impairment. Abnormalities in CSF biomarker levels also aligned well with amyloid assessments using positron emission tomography imaging. Furthermore, CSF biomarker ratios were found to be more robust and reliable indicators than individual markers and produced fewer false positive and negative results. Overall, the researchers suggest that a comprehensive approach, including cognitive and psychiatric assessments, neuroimaging, and AD-CSF biomarker assessments, can aid in the timely and accurate diagnosis of AD. Incorporating biomarkers in the standard of care for AD can thus improve disease management. Potential uses of fluid biomarker analysis may also include risk assessment of patients and evaluation of treatment responses to novel therapies.